So I'm really happy. Thank you. So I'm happy that this is coming, especially at this time. There is no better time to have this kind of conversation. Also, I understand that I have 15 minutes and I think an extra 10 minutes for questions, but I don't anticipate that I'll be speaking for that long. So I'll try to keep it under 30 minutes so we have more time for questions. Pass this through my just here and it makes some noise. So okay, so I would share my screen now. Um, okay. Yeah, I think this works. Um, all right, so we'll be discussing building a rewarding career in food policy and advocacy for nutrition. Although, I mean, because this is the topic as well set by INEI, but although you'd find that this is more just talking about food policy and what it is and what it can do, rather than telling you how to build a career. And as you would guess, that's because I myself, I am only just starting out. So I don't think I know very much. I don't think I know a lot about building a career in food policy. But I know a little bit about food policy because it's something I really like and it's what I'm also currently studying. Um, so I'll just be talking about food policy in general. Also, I'll be speaking largely within the context of Nigeria because I'm assuming everybody in the call is Nigeria. I mean, so if I make any reference that at any point in time you feel, oh, I'm not Nigerian, I don't understand this reference, just put it in the chat box or ask a question afterwards, and I'll be happy to clarify what I mean. We have more people than I expected on the call. Yeah, so I think usually when we talk about food policy or food and nutrition policy, the first thing that needs to be clarified is how policies vary from programs because within the nutrition world, so to say, and I think another assumption I wanted to clarify is I'm assuming everyone in the call is a nutritionist or has some nutrition background. If that's not the case, again, please just let me know in the chat box, or you can, if you are not in a very noisy place, you can just unmute and stop me at any time for to clarify anything. Because I'm not sure I'll be seeing the chat as they come in. Yeah, but the assumption is everyone knows it, about nutrition. Um, so I said the first thing I was going to do is to make a distinction between policies and programs, and that's because within the nutrition world, most nutrition professionals are used to programs. Like programs is what you are trained to do because uh, nutrition comes with interventions. We say nutrition interventions all the time, and that's because unlike say the medical profession, for example, where they treat sick people, what nutrition professionals do varies widely. What we do requires some level of behavior change intervention or um, um, giving access to people, um, sometimes literally giving them food to eat, teaching them new ways um, to make healthy diets and policies. So a lot of that we call them interventions because that's really what we are doing. We're not treating, we are intervening in because food is life. Food is a way of life. It goes beyond just putting something inside your body. It's cultural, it's social, and that's why a lot of the activities that we do, even at the clinical level, we call them interventions. And what a lot of nutrition professionals are used to is this idea of organizing a nutrition intervention. Usually, those intervention comes in the form of programs or projects, and for many, many years now. We've all worked within that framework. But policies differ because policies are not like short-term intervention projects that seek to solve a particular problem. Policies are, in this definition that I copied from the internet, they call policies covenants that I'm going to break down that those parts I highlighted later, collectively choose to live by as articulated in legislation and regulation, and they inform socially accepted morals and ethics. So basically, I think the first thing there is the fact that policy is a covenant. It's not just something that one person does. It's built on a particular foundation. Usually, that foundation is either a government institution or a private sector institution. It's a foundation of trust, of collaboration. Also, it is long term because nobody goes into a covenant for a year or 2 years. Usually, it is articulated in some form of legislation or regulation. It's rooted in law, in public institutions, and it informs how we behave. So, for example, if you are speaking within the context of a country, for example, a policy would be something that informs how the government behaves, how the government spends money, what kind of laws the government emphasize, what programs the government implements. So policies informs that. Policies informs the laws that government enacts relating to food and nutrition, for example. And in that sense, it differs from programs, which is just a very short-term intervention to address a particular problem. Again, I'm sure if you have a background in nutrition, you will be familiar with this framework for malnutrition. Again, it's something I stole off the internet. I think this is one of the most recent ones. But for those who do not know, this is a framework that was designed by UNICEF, and what this does is to conceptualize the entire idea of how malnutrition comes to be. So this is a breakdown of the causes of malnutrition, so to say, or the factors that are associated with malnutrition. So at the very top, you have outcomes, which is the onset of malnutrition itself, and then you see things like health, physical growth, productivity. Like so, that's basically what you see that is manifested as malnutrition, or the opposite of it, like good nutrition. So the things that you can see: survival, productivity. How exactly does nutrition affect us as human beings? Because it's UNICEF, it's focused on maternal and child nutrition, but then that's everybody. So that's the first part. Then this is second, we call them the immediate determinants. These are the things that the immediate factors that drive those outcomes. So we have majorly diet and care. Diets, your access to actual food, you eating good diets, and then care can be health access to healthcare. Things like breastfeeding goes under care as well. And then a step further, you have underlying determinants. These are factors that influence these outcomes, but they are not factors that are immediate, in the sense that you as an individual, you don't interact with those factors directly. So for example, a very good example of this is environment. So when say food environment, usually the like food safety, for example, or how food is prepared, mostly at the food industry level, or the availability of food. You have having food in the market, for example. These are factors that you don't directly interface with as a consumer, but they determine how they determine the nutrition outcomes for you. So we call them underlying determinants. And then the final one are enabling determinants. So these are things that you cannot see with your eyes that sort of also influences the nutrition outcomes. So basically governance, resources and norms, resources in terms of economic resources or environmental resources, rainfall. These are, of course, you can see rain, but these are not things that an individual can control. These are not things that you see, but they influence nutrition outcomes. Now, when we're trying to discuss policy, usually policy is discussed at the level of the underlying determinants and the enabling determinants or the enabling environment. Most policies attack the enabling environments because that's the level where we have governance, political governance, financial governance. And so although some policies can touch on underlying determinants, but for most of the time, policies address the enabling determinants. And food and nutrition policies, they basically govern all the aspects of the food system that impact food supply, nutrition status, food choices, and prices. These are like the top areas that food and nutrition policy addresses. And there are like three sides to it. There is the policy formulation, that is actually writing or designing policies. There is implementation, and then evaluation. And this three goes hand in hand. So you evaluate a policy because you can identify a problem, or at every point in time there is a policy. There's always a policy in place because not doing anything is a policy. So, for example, if the government does not devote any funding to nutrition intervention, that's a policy. It's a policy of government of not devoting funding to nutrition intervention. And then, so usually when you want to formulate a policy, the first step is to evaluate what is on the ground, and then you formulate a new policy, and then you implement, and it goes on and on like a cycle. Yeah. The other thing I was going to mention is that even though you would often hear food policy as a standalone, and then nutrition policy as a standalone, nowadays I think the right thing is to bring them together as food and nutrition policy, and that's because food policy on its own does not care about well-being. Food policy cares about primarily cares about the economy and how food relates to it. So the entire concept of food policy was introduced by economists. So you usually find like agri-economists or core economists interacting with this field. And it's largely because for some reason, the economics, they realize that people have to eat, right? People cannot survive without eating food. So food is a critical part of the economy and of social well-being. And because of that, they had to, devote time to study the economics of food. How is it produced? How much are people paying for it? How is it traded between countries? Now, that they don't really care if you are getting enough vitamin A or enough iron or enough protein and carbohydrates to eat. That's not really a concern for food policy. And over time, as nutrition evolved, in more recent years, we now see people say no. Food policy in itself is not sufficient to address the challenges of the world today, and then sort of weave in nutrition into it. So we have food and nutrition policy. So for the rest of this conversation, I'll be saying food and nutrition policy and not food policy, because in reality they are different things. And on your own, if you try to study, so you go to places where you want to study food policy and find yourself doing agric and economics, basically. Um, but then that doesn't solve the challenges of today's world, because it's not just about having food in abundance. It's about having the right kind of food to the right population. Um, and again, nutrition policy is a very, very, very recent development. Even globally, I think the first major um, conversation around nutrition policy was in maybe 1961 or so, when or thereabouts, when the US had their first White House conference on food, nutrition, and hunger. And I mean, in relation to the timeline of things, that's very, very recent. We discovered vitamins 300 or 400 years ago, right? So, um, having to talk about nutrition within a policy context as recently as 50 years ago is not good enough. I wasn't born then, so I don't know what they were thinking. Uh, but yeah. So, before I go on, I wanted to take some time to um, talk about my personal journey into food and nutrition. I promise you, this is not a biography, but I think that it's anytime I think through how I got to like be in this field, like doing what I currently do, I I think my journey has been very instructive in a sense, because I I couldn't have found myself doing anything else, even though I tried to. So I'll just tell the story. Um, my dad is a lawyer and my mom is a businesswoman. She sells eggs. Now, if you grew up in any Ni- regular Nigerian home, you would know that there are a few professions that are allowed as a child. So as a child, you had quite a few options. It's either you want to be a doctor or a lawyer or an engineer, and that's it, right? Uh, someone help me with that. I'm sorry, that was just a weird distraction. Um, yeah, so I was saying, if you grow up in any regular Nigerian home, it's either you want to be a doctor or a lawyer or an engineer, and I don't think you had any more options other than that. And it was the same with me. So you would imagine that, like, being born to a lawyer and a businesswoman, how how could I have possibly found the inspiration from them? And I did, to do what I'm currently doing. But so very early, as kids, they would ask you, so what do you want to become? And something weird happened when I was in primary too. That's not a biography. But I had this bully classmates who would tell you, oh, lawyers are liars. And then because of that, I said I wasn't going to be a lawyer. So of course the other alternative was to be a doctor, right? Like those are the only two options, the only two real options available for you. So I was going to be a medical doctor, and I believed it partly. But then when I started taking science classes, and I realized I wasn't too good in the sciences. I wasn't bad, but not. I mean, if you would have at that level, I'd read Ben Carson's Gifted Hands. I they dreamed about being a neurosurgeon and all of that. And then as time went on, I just realized that I'm not cut out for this. Like, there's no way I cannot be having C4 in physics and chemistry and want to be a neurosurgeon. Like, it doesn't make any sense. And then at the same time, I was drawn to the um to the arts and humanities. So my brother then was in the arts class. So I would just go and take literature classes and take commerce classes, history classes, just for fun. I would literally stab my own class just to sit in. I would read the literature text because it was fun. I would read Shakespeare and all of that. And I sort of found myself in between two worlds. So I was a science student, right? And I wanted to be a doctor. I wanted to be the next Ben Carson. But at the same time, I found my interest somewhere else entirely. And I had that struggle up until when it was time to go to the university. And of course, I was in a pre-med program, still trying to be a doctor because everybody is happy that you want to be a doctor. Um, but at some point I just said there's no way I'm doing this, and then I took another jump and I was looking out for programs. So I saw that the University of Ibadan College of Medicine had different courses. I wanted to remain in College of Medicine so I could convince my dad that I'm still trying to be a doctor. So I was just researching all the courses under College of Medicine. I had the prospectus, I had access to it somehow. And then I saw nutrition and I saw the classes in it. And I thought I had a very nice balance between social sciences and humanity, which was, what I really liked. I even saw that we could take some social science courses. They scammed us with that thing because when I got to this career, I realized I couldn't. Some economics courses, some of the courses were like talking about community nutrition. It wasn't science. Of course there was some biochemistry which I hated, but it was more than science. And of course now that I've gone through university, worked a bit, I know why it was tailored that way. Nutrition is not just science, it's far beyond science. And that was how I realized that, oh, I can really do this. And I did. And from my first year, I knew I wasn't going to do like clinical nutrition or anything like that because that's not where my interest lies. It was just really cool that I was able to find a good balance between the sciences, which I found myself in out of, a lot of misguided activities, and humanities where my core interest lies. And looking back now, I realized that a lot of that, like a lot of the inspiration for being somehow in between the world of nutrition science and humanities is drawn directly from my parents. So I said my mom was a businesswoman. She sells eggs. Um, she would go to the rural areas in southwest Nigeria, aggregate eggs. Eggs are like, if you live in a developing country like Nigeria, where we are from, that's the cheapest source of protein. So it's an important economic commodity as well as a nutrition commodity. It's a very critical one. She was interfacing across the food value chain because she would interface with farmers, bring it to the city center, and then sell to retailers and consumers who would eat the egg. So she was at the nerve center of the food system, so to say. And my dad has and I learned a lot from her, just understanding how prices change and how farmers will say, oh, maize is scarce, we can't feed the chicken now, we can't get enough egg, and um, consumers are complaining that they cannot afford to buy enough egg and their kids cannot eat, and all of that. Like I grew up seeing a picture of the food system unconsciously. And on the other end, um, from my lawyer dad, I understood, legal frameworks and how society works from a legal and policy perspective. So it is not entirely strange that I now found myself within, in a field that allows me to literally draw from the both of them. And that's really the journey of food and nutrition policy. It's a critical intersection between the institutions that make society and the science of food and nutrition and wellness. Um, so I, I'm just going to speak through some of like I call them elements of food and nutrition policy that you should keep in mind. In the last few years of working in this field, these are the things that I have learned, and I think you should also, and I think, you'd benefit to have them at the back of your mind if you are trying to follow this path. Um, First is that it is more about policy than it is about food or nutrition. So food and nutrition policy is a policy field. So you have to understand, and I think this is the most important part. you have to understand that this is primarily policy. So you are no longer competing with you're no longer competing with nutritionists. You're not working within a nutrition framework. Most of your colleagues, like if you're in an organization, for example, most of your colleagues will not be nutritionists. Most of the people you interact with constantly in the course of your work are not nutritionists. So it's a different, you're working in a different environment that has different language, a different lingo. I remember at the Food System Summit, the Nigeria, I think the National um, Dialogue of Food System Summit, where the Vice President spoke. One of the very first things he said was, "Oh, you nutrition people just speak so much, you know, jargons, not his exact words, but a lot of technical stuff, and he doesn't understand." And in Nigeria, the vice president is the chair of the Nutrition Council of Nigeria, which means that at the very high level of nutrition policy, we are speaking a kind of language that the decision makers do not understand. And I think that's a consciousness that you have to carry, that you are a nutritionist, of course, and that's the foundation of everything you do. But this is policy. This is a different language. This is a different environment. I have to understand that. So just branching off that, now that I know this, I would advise people, and I would advise, of course, it's my advice, do not take it, that if you already have a solid background in nutrition, so for example, if you studied human nutrition at the University of Ibadan, um, I know you have a solid background. If you did it at some other universities, maybe not. I don't know. Apologies, especially those guys those other guys from the Southwest that try to. Anyways, um, I never miss my chance to banter and um, what's it called, enforce UI superiority. But if you have a solid background in nutrition, if you studied human nutrition, or you have worked for many years as a nutritionist, you know your proteins and your carbohydrates, you know what RETF is, you know everything about community-based management of malnutrition, you know all those technical stuff. If you do, and you want to do a graduate program, I would advise, if I knew this like 5 years ago, maybe I would have taken a different path. I would advise you do, and you know that you want to pursue a career in food and nutrition policy. I'd advise you do a graduate program in a core policy course. So maybe public policy or even health. So nowadays, a lot of schools have really solid health policy programs that are not too technical. So they focus a lot um, on the policy aspect of it, understanding political systems, understanding health systems. Now they do this within the health context, so the examples are like health related examples, but there are things you can relate to because nutrition and health are like cousins. And also they're just really easy examples that you can borrow from. So I always advise you do a graduate program if you want to pursue food and nutrition, and you already have a solid background in nutrition that you are confident in. That and of course not just to you, but you are also thinking about a potential employer, right? So if you have that, so you have significant work experience, you have a good first class degree in human nutrition, then you don't need a graduate, and you want to work within the food and nutrition policy space, then you don't need a graduate degree in human nutrition. What you need is um, a graduate program that helps you hone your policy skills, because that is just as important as your understanding of nutrition. If there are any like program managers who work within nutrition as well, they will tell you that 90% of their job is project management, replying emails, writing plans. None of like sometimes you go months without thinking about carbohydrates, and it's the same with policy. You go months without actually thinking about food or giving a talk, because it's very policy heavy, and that's very important. The second thing I would like to mention is that a career in food and nutrition policy requires very high level of institutional level thinking, not individual. At this, level, you are not catering to individual human beings. many times, if you work within like the nutrition policy like framework, you probably be behind a desk 90% of the time or in front of an audience giving a presentation. You probably never, unless you make extra effort on your own, probably never see an actual child suffering from severe acute malnutrition. You probably never visit a farm. You probably never actually, unless you take the effort, you probably never actually interact with the things that you are writing or talking about or working on, because it's you're working at a high, we could say high level. It's not, I mean, so I'm always very careful when I use that term high level, because then it's like, oh, so we were low level, Abby. No, but the idea is, how a bird looks at things. There are people who work, at the granular level. There are people, for example, who work with like nitrogen, right? Very, very granular level. Their work is so important, just as important as those who work on like community nutrition, who, try to devise new methodology. Their work is just as important as those who work in the hospitals or those who work on meal plans. Your work is to bring all of that together and synthesize it with, say, 17 other programs of government. So the president wants to roll out his 7-year plan for national development, and they say, oh, of course, nutrition is a priority. You're going to bring everything that we've been talking about around nutrition. Like if you look at like maybe there's a state of food nutrition in the world or something, or any of those documents, like 700 pages, or FAO's report on food systems is like 600 and something pages. You're going to take all of that, and at the end of the day, your contribution to the national development plan is going to be at best a page or a few paragraphs. So you have to understand that. So you're working, you think like an institution, and you think in terms of institution, public or private institution. You're thinking, oh, how can this fit in a whole? You're not thinking at an individual level anymore. And it's important to train yourself, to think that way. So for example, you can just as a hobby, you can just look at situations, like look at a problem. Oh, someone comes to you, you work like as a dietetic, and someone comes to you and say, so you're trying to, counsel, for example, you're trying to counsel a let's say a diabetic patient, and you're trying to counsel them to say, oh, you have to reduce your intake of fufu, and she tells you, I have nothing else to eat except fufu. As a policy, like as someone who wants to think about policy, you don't just think, how can I give this woman options? What you think would be, what can we do to ensure there are more food options or meal options available to people of this age in Ibadan or in Oyo State? So you are thinking as an institution. So what can so let's say you're advising the governor now. What can you tell the governor? What can the governor do to ensure people like her have more options? So then you start saying, okay, maybe we can design a program that tells them about all the available options. Maybe we can commission a research to investigate indigenous food, indigenous meals that has gone extinct that we can bring back. So the idea is to think at an institutional level and not as an individual. If you're thinking at an individual level, the solution to the problem is very easy, right? But from an institutional level, it's not that easy. And then you start thinking about, you have to worry about other things like funding. Also, whatever you are proposing, can the government afford it, or can the company afford it? If they can afford it, where is that money coming from? um how does it affect the environment? How does it affect climate change? How does it affect perception of people? Would they say he's wasting money on this program? Because that's the idea behind thinking as an institution, and not for an individual. I think for an institution, rather, whatever your plans, whatever your proposal, it has to be within the context of an institution. Oh, time. I'm sorry, I talked too much. The next thing is that it is multi-sectoral, and I think I've discussed this while thinking about institutions. So I have just one more slide actually. You are you're working within a very diverse team. It's multi-sectoral, it's multidisciplinary, it's multidimensional. It is no longer focused on nutrition alone, even though that's the foundation. But it is, you're working across teams. You're working with economists. You're working with communications experts. You're working with people from the academia. You're working with people from health. You're working with farmers, all sorts. Also, and this is important, a lot of the things you would do would be based on global consensus. So FAO says this, WHO says this, you know, global consensus, global best practices as we call them, but for local applications. So you're constantly, switching worlds. You're in a global setting, you're like, oh yeah, the world needs to reduce hunger by 50% in 2030. And then you come back to, your local setting, and it doesn't have to be like a particular country. Local settings could be your company, it could be, and I'll speak on that shortly. But, and then from that global consensus, you now have to like sieve it out and see exactly how your own little place fits in. And then finally, policies never work until they do. So the point of this is like it's a long, tedious process from formulating a policy to implementing it. It's tedious, it's annoying, but the beauty is that the results are usually massive. So if you're a dietetic intern, and I keep using this example, apologies to actual dietetic intern, it's just the easiest example that comes to my mind. If you're a dietetic intern, you meet that woman that I talked about, you give her a good counsel, you help her, you solve her problem, she's healthy. That's one person. You can do that in a few weeks or a few months. If you're a policy professional, you are working on one very like maybe a 3-page policy paper or a policy idea for 1 year. You are having meetings with people, having stakeholders meetings, debating all of that just to produce a 3-page paper that you feel like you've done nothing. But when that policy is implemented in 3 or 4 years, then you realize that the impacts and then the spiral and then the like first of all the outcomes, then the impacts affect 20 million people. So it doesn't work. It feels like you are doing nothing until the result comes, and then you say, "Oh yeah, I've been doing a lot of work." And where have those places? So I'm just going to run through the kinds of places where policy is policy work is done. Government and public institutions. I think I've spoken extensively on that. International public institutions, national, subnational. So like from a local government, your states, the federal government, the United Nations, or whatever, ECOWAS, all of that. Then we also have policy being done within private and for-profit institutions. So you work for a food industry, and you're trying to help them, design their policies. So, for example, Coca-Cola want to reduce sugar consumption, and you are the nutritionist on board. So for you are saying, oh, we have to eliminate sugar from our Coke or not, whatever. But because you're working within an institution, you're now telling Coca-Cola, well, you understand as an institution, you understand like people's taste bud doesn't just change overnight. So then you are saying, let us change the formula, maybe reduce it by 5% this quarter, next quarter reduce it by 15%, something like that. So like you can work within private institutions. That's the point I'm making. Within for-profit institutions to help them tailor their policy to favor nutrition in a way that also helps the institution. Of course, you can work within NGOs, policy think tanks, advisory groups. I said not. So this final part is just I was trying to draw a distinction between academic kind of research and policy research. So academic research is to contribute to the body of knowledge, right? The focus is knowledge. What don't we know? What do we need to know? And that is fine. That is the academia. But as a policy researcher, which you have to be a researcher as well, you whatever research you are doing, whatever questions you're asking, it is to solve a particular problem that can be implemented within like immediately. So you will not, like, as a policy researcher will not go on a frolic of investigating the let me look for a reasonable example. I'm terrible examples, as you can tell. A policy researcher will not go and say, oh, is it possible to have plant-based meat, for example? You wouldn't like go and start doing that research. If the research has been done and there's plant-based meat, the policy researcher can now say, okay, how can we, implement this within the country, or how can we encourage people to take this? But you wouldn't go and investigate that, from the start. That's the job of universities and academic institutions, and that's the difference between policy research and academic research. And this is just a list of like skills that I should pay attention to. I mean, you can just look at them. With all of this, we call it like policy analysis skills. But I try to break them down. In research, you have to know how to read, conduct, and communicate research, because this is what would inform a lot of like policy decisions. You have to understand statistics a lot. You have to be adept at monitoring and evaluation, because you're constantly doing that as a policy professional. You're constantly asking yourself, is this working? How can it be better? You have to be able to write, because it's just how the world works here. Like, there's a lot of writing involved. You have to write policy memos, you write letters, annoying emails, and all of that. Public speaking and presentation, because you are, like I said, you are working outside of nutrition environment, so you have to do a lot of debating, a lot of convincing people, canvassing a point of view, advocating for a particular initiative, and you have to do that a lot of time. Like, this is what you do constantly, several times a day, several days of the week. You're constantly writing, you're constantly, and this is like 90% of your job. Just writing, evaluating policies, looking at statistics, using it to make your case, and all of that. And I think that is all. So yeah, now will be a good time to take questions if there are any. I'll stop sharing now so I can see faces. Yeah.
Thank you so much. Thank you so much, Peter. It's like, I mean, I hope everyone was like me, or because I was taking down some nuggets, right? Thank you so much for this lecture. So I'll be handing over to my colleague. So basically, she will just, walk through the Q&A just so that it's all organized, because some people have some questions already in the chat box. And of course, I know that some people would obviously want to speak, right? So Damilola will just be taking over to walk us through that session. Thank you so much again, really.
All right, thank you so much, Uju. Can you all hear me, please? Am I audible?
Yes, we can hear you.
Oh, thank you. Thank you so much, Mr. Gbenga. Thank you. Please, in case you have any question, you can either type it in the chat box or signify by raising your hand, and we'll take your question. So, Mr. Gbenga, we have a question from, I think, Chris. She asked, what is the typical day in the life of someone who works as a nutrition policy advocate? Is it within like kind of day or something around that question? Do you understand the question, sir?
Yeah, I do. Thank you. And I think I saw it, and I tried to cover it because I was rushing for time. That's a very interesting question. Thank you very much for that question. I actually think there's someone else here who would probably answer the question better, because I haven't been a policy professional for a while. I've been a student. But like I said earlier, I would say some of the things you would do the most would be, first of all, a lot of writing. So let me just describe what the job entails. And again, this is different for different fields, depending on where you are. So if you're working for a think tank, for example, usually think tanks are like they're like groups that are focused on advising governments or private institutions on like key policy issues. So let's say you work for a think tank and a particular state government comes to you to say, I have $100 million and I want to improve. This is very like vague. I want to improve the nutrition status of my country, of my state. I want to reduce stunting from 27% to 5%. Um, please, can you help us, with ideas on what to do with this money? Right. That's like this is the dream of a policy analyst or a policy professional, right? That's like a sweet project. So your job is to now, look at the states, read a lot of research. So reading a lot of research about the state, understand what is happening. So you would also have to do a lot of stakeholder meeting just to understand what happens at the state. Remember, I said earlier that there's always a policy in place. So your first job is to understand what is happening at the time, and then of course learn from. So I also talked about global consensus, local application. So then you look outwards, look at like other states, for example, within and outside the country, look at what they are doing, update yourself on the latest research around food and nutrition interventions. What are like the best kinds of interventions nowadays? People are talking about the power five and how if you want to reduce stunting, you have to focus on 5 key interventions. I'm not going to say because I don't remember all 5 of them, but I know micronutrient supplementation, starving, whatever. So you update yourself with like relevant knowledge, and then you do a lot of writing. So basically, a typical day is you doing all of this together. So you are reading, you're writing, you are, conducting research, you are talking to people, asking questions, investigating. So your job is basically like an investigator who sits behind the desk and has an assignment. Like you have an assignment, you're trying to um, understand how you can help this institution or this company to solve a particular problem within an institutional context. So it's a lot of knowing how to think, knowing the right words to say, knowing how to say them, and a lot of constant learning different kinds of things every day. I really hope I answered that. Um, yeah,
All right, thank you so much, Mr. Gbenga. So
yeah.
there's another question from Enoch. He asked, as a student, how do we dive into this part of nutrition while still a student? He believes in starting somewhere and going with the process. There is also a question
Ye-
related to that from someone else.
Okay.
That says, are there platforms for students?
Yeah, so I'm happy about that question. I wasn't sure if like majority of people on the call are students or not, so I didn't want to, base it. But yeah, it's very important that you start thinking about this early enough if this is the career you want to pursue. So I when I was in an undergrad, I did a lot of debating, and I think that's helped me to see it significantly helped me to to build how I think about issues, because you're always debating. So you hardly. I don't think there was any. I did Jowo. If you know Jowo, if you go to UI, I don't think there's any Jowo topic ever that has to do with nutrition. So you are constantly, thinking about all sorts of things apart from nutrition, and that's helped me to think from a dimensional perspective. Um, so as a student, definitely join the debate club if you can. It also helps to build a lot of all these other skills that I've talked about, your research skills, your writing skills, all of that. You can build it as a debater. So join the debate society. Um, uh, there are also other organizations where you learn, several skills that builds it. But I think if you want to do policy analysis, I really think that that debating is like the biggest, is the single biggest activity you can do on campus that will prepare you for this outside nutrition. I think the other question, so I'm just going to read it again.
Talking about having the platforms for students, I think is related to the previous one.
Oh, yeah. So I think that's it. So there are also international student platforms that you can take advantage of. They're like there's this UN youth. I don't remember exactly the abbreviations, but I can pass it on later. Youth for Change or something like that. That focus on nutrition. So there are lots of, you can look out for international youth organizations that work around food and nutrition. These, they have conferences that can help. Also, and this is just something you can do on your own as a student, just try as much as possible to keep yourself updated about events happening. If you are in UI, and I'm sorry for those that are not, a lot of the curriculum is quite, it's updated quite well. Like they have a lot of, they use a lot of recent examples and all of that, but still it's never enough. So you would always have to, on your own, go on the internet, follow conferences, follow people on LinkedIn. So you can just as a hobby, you can just look for people working in like organizations like IFPRI or Rockefeller Foundation, like people working within the nutrition field. And you'll actually find that lots of people who are working within the nutrition policy environment are not even nutritionists. Like a lot of them do not have a background in nutrition. And more and more people, they are looking for people who have a background in nutrition because they believe that you have that foundation. But then you still have to, because your work is majorly policy, you still have to have a lot of, you have to show proof that you understand policy in addition to your nutrition background. Nobody will hire you as a policy analyst just because you have a nutrition background. But so follow like updated conferences. Just keep yourself updated with recent happenings around the world. Just try as much as possible to learn. And you're a student, that's basically what you're trying to do. Learn, but do it widely. Don't just focus on like nutrition and like what's taught in school, but learn widely. Learn, like, know when the next food system conferences, know what's food system summit, what's like, how does climate change affect the food system. Know it's at the back of your, like, know it's like you wake for your dream, and you can explain these frameworks, and also do a lot of work to build your confidence in developing ideas on your own, because that's one thing you're going to do a lot. I'm speaking very in a very unstructured manner, so I'm really hoping you're catching some of these things. But like a lot of your work, a lot of the work of a policy analyst or a policy expert is forming your own ideas. And this thing, I'm sorry I'm taking it quite long, but this is important. Forming your own ideas is not just about having a brilliant idea. It requires a lot of confidence to say, I have this idea, I think it will work, I'm going to pursue it. Most of the time, the people you are communicating this idea to, they don't have an idea themselves. They don't know what to do. So you're in a table, in a round table in a think tank, and people are like, oh, what can we do? 90% of the time, every other person on that table, they are clueless, just like you. So if you have an idea, there's a level of confidence you need to have to be able to like develop that idea in your mind and communicate it, that I think this is what we need to do. And a lot of times that's what is required of you as a policy professional. But you need that confidence to push those ideas forward. And this is something you can develop as a student. So like, just try as much as possible to build your capacity in developing ideas and communicating it, so that you are more confident about yourself, that, oh, when I was in the uni, I had an idea for us to, something as petty as erect a new billboard, and it worked. So and the more you do things like that in very little capacities, you build your confidence. You're more confident in yourself to provide solutions that work, and you're able to do it more frequently. Let me just get back to another question here. So apart from so this is Josephine. Yeah, public policy. What other courses would you recommend looking up? So this also depends on what field of public, again, like nutrition policy is quite wide. So if you want to work within private sector, for example, you don't need to do public policy. So if you want to do private sector, you can even do an MBA. You can do an MBA. You can just do a regular health policy program. And I think I mentioned health policy because they've developed the curriculum for health policy much better. You can do an agric program. You can do an environment program. It all just depends on where you want to, the kinds of job you are looking to attract, and then you can tailor your graduate studies to fit that. But like I said, what is important is that you get policy, you get policy training. You are trained on like policy formulation and all of that. So yeah. Okay,
I think the other one
obviously.
is asking if there's any intersection between a nutrition policy analyst and a public health nutritionist.
Of course, yes. I mean, so first of all, I think a nutrition policy analyst is a public health nutritionist. There's a lot of like limitation to how we think of public health, but policy is an integral part of public health. In fact, policy is, in my opinion, the most important part of public health because that is the most effective way to address public health issues. So you cannot, when we think about public health, we should not only think about small scale interventions in one community, because that's what we often think about as public health nutritionists. But yes, that is public health nutrition. But when you have an intervention that goes into a legal framework that affects 100 million people, that's also public health nutrition. Yeah, like it's also, so the only difference I know is between precision nutrition or like, yeah, precision nutrition, but that's like an entire field on its own. So I don't want to use that term. Or like, let's say individual nutrition and public health nutrition. Those are the two distinctions that I think we should make. So individual based nutrition is you're a dietitian or you are a clinical nutritionist. You're trying to manage this person. And then public health nutrition is you're trying to, think about interventions that address most people, the public. That could be either as a program or a project, which I talked about initially, targeting a short-term group of people, or a policy targeting everyone. I hope that is clear. This person says, I'm surprised. Do we have just one Uju Onora, or do we have like a million? Or is it just me having that?
I link the
yeah. I'm sorry about that. Are there activities or programs that the university can introduce to build interest? Yes. Yes, actually, there are. And I think the university, especially like the Department of Nutrition, in any university in Nigeria, from my experience, there's a lot more that they can do to build interest in policy. First of all, there is no course that teaches nutrition policy, and I think there should be. I think it's important to have that in the curriculum. Also, there are like side events that you can have. You can have simulations, case studies, simulations that allow students to just practice, real life policy issues and how to solve them. But I think a lot of this can go into, the curriculum of the university and the department. And I think it's important. If the person asking this question is a professor, a lecturer, please Yeah, I know there's a policy course, but even that course is not. I did at you. I did the that's 4-1 now. Is it 4-1 or 4-10? It's not. It doesn't really teach policy. It just highlights different nutrition policies and like tells you about them, but it doesn't go in depth into nutrition policy. I think they should have maybe at the master's level if possible. But yeah, and then there are activities, case study activities, bringing in speakers who are like policy experts, reviewing, like you can have like a policy club at the department that just once every month you guys come together and review one country's policy as a case study, discuss it, you know, and this is something that students can even do on their own, just to for those who are interested, just to sustain that interest and train them to to learn to think as a policy professional. Yeah. I don't know if there are any. I think that's the last question.
Is there? Do we have anyone with any other questions, please? Okay. In the absence of none, I want to thank everyone for their questions and Mr. Gbenga for giving us perfect answers to every one of them. So I would like to ask this final question that, based on your experience in this field, what are the limitations or the challenges to look out for?
Yeah, thank you. That's a very good question. I said that one, I don't know what to say. So there are lots of challenges. I think I spoke about one of those challenges earlier, and that's the fact that you are not working with nutritionists. I know when I said it in the sense of, oh, you have to be able to, speak in clear terms without using technical lingo, which is hard because you're not, I mean, even lawyers who use plain English still find a way to confuse everybody. How much more you like it's a very like it's science, and you're trying to communicate science to people who either do not care or know nothing about it genuinely. So just working within an environment that is not um, trained to understand these issues can be hard. And in many ways, one of those ways, it's just that sometimes they don't understand the problem. So you are saying, for example, you are saying 10% SAM, severe acute malnutrition, 10%. As a nutritionist, that's alarming. It's like, what? 10%? Like it's alarming, it's crazy. But then you're talking to the CEO of a company who is like, he just doesn't get it. And it's like, how does that reduce how much, like why should I care about it? And it's your job to make him care about it. It's really challenging to do that, which is why you have to train yourself early and just get ready for that painstaking effort to get things done, because it can be really hard just communicating things that you understand it very clearly. It's clear in your eyes. And because so usually I think they call it the burden of knowledge. When you know something very well and someone else doesn't get it, it can be really frustrating, because it's like you have a clear picture in your head, you know what you're talking about, but they just don't get it. And oftentimes it's not because you are unable to communicate it well enough, but you spent 4 years studying this thing. So of course you get it. It's not because that person is bad or because you are bad at communicating. It's just that they haven't devoted as much time as you have to understanding it. And they don't need to devote that time. It is your job to find a way, do miracle, whatever, to make them get it. So it gets really hard. And I think that's the most challenging part of being a nutrition policy professional, because you are not working with it. It's when you are in like your department, or when you're talking to like nutrition people, or you're at a nutrition conference, it's easier to say certain things and everybody understands what you're saying. But then that's 90% of the time, that's not the kind of environment you're working. So I think that's the most challenging part of it. Yeah. That's a very good question. Thank you, Damilola. I think someone has a question. Adeolua.
Okay. Yeah, good afternoon, everyone. So it's not a question per se. I just want to add to what Gbenga said so far. But specifically on the issue of the challenge, what are the possible challenges that a policy person, a nutrition policy person faces? I think one major thing is also the will of the decision makers, because you have to, it's one very important thing to secure the will and commitment of the people that are making the policy decisions, the main decision makers, it's, take for instance in a government or even in a private organization setting, no matter how good your policy is, you have to get the buy-in of the people that have the power to do it. Because you, the policymaker, you have some level of influence, maybe the technical abilities, but then you are probably not the exact person that would enact this into, that will make the policy. So that's one thing. Then also in the case of governments, one general thing is limited funding. The funding is never enough. So yeah, so I think that's also one thing in terms of governments. When you have good policies, you also need funding to implement some of these things, to convert them into programs that will help the policies to work better and well. So those are some of the things. Then just chipping on the other parts in terms of what you can do as a student to prepare yourself for the policy space, or entry into the policy space after school. I think one very, as I mentioned, the core skills that you need to build. Then I think one other thing that you should also add to that list of skills, aside the critical thinking, presentation, communication, writing, and all, is also the ability to network. At this, you are probably still in school as a student. You should be able to network, reach out to people, form connections that are useful. In terms of forming connections, it is not enough to walk up to someone and just, okay, explain, introduce yourself, blah, 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 a student of blah, 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 I would like to meet you. I would like you to be my mentor. Not everybody will be your mentor. And the people that you are meeting already have enough people that have come to them for mentorship and all. So it's, when you are going to people, you have targeted inquiries from them. And also, if you are already prepared in the sense of you've done your assignments, take for instance, we had the NSN conference, that's the Conference of the Nutrition Society of Nigeria last week. And so if you're coming for such an event, you already know, the topic, you can have an idea of the set of people that are coming. You should have done some series of assignments on your own to know exactly what you want to get from this event, the people you want to meet, the inquiries you have for them, the specific things that you have for them. Then also everybody that wants to form a very good connection with you. Also, most people don't want to start from the baseline or ground level of telling you, okay, do this, do this, do this, do this. So you also have to come with a level of contents. You must have some certain contents that, okay, when you present that to them, okay, I think this one looks like a serious person. So that's also one very essential thing, ability to build very good connections. And when you're building connections, also remember that you're not starting from ground zero. You must be at 50%. So for the person to help you get the remaining 50% to make 100. Yeah. So yeah, that's about it. Let me not take too much time. Thank you.
Yeah, thank you so much, Ade. That was thank you for saving me. That was really important to add, especially the bit about networking, because a lot of the job is also knowing people that can help, push your agenda. Yeah. Most of the time you are trying to push an agenda. That's just the summary of it. You're trying to push an agenda, in the midst of other conflicting priorities. If you're working within a private company, and they're trying to make money, you are trying to get them to make um, healthy snacks. You are trying to get them to use a particular um, ingredient that has more nutrient level, and they're trying to make money. You have to make your case, and to do that, you need people. You need to get the accountant on your side. You need to get the procurement officer on your side, and that requires a lot of networking. And it's a very underrated aspect of the job that you need to prepare your mind for. So thank you, Adi, for adding that. Who's going to take it over from me? Uju, or is it Dami?
Okay. Thank you so much.
Since Damiola's network is a bit. Dami, can you hear me? Okay. Seems her network.
So everyone who would be interested in, yeah, but can you hear me now? Yes, I can.
Yes.
Yes, please. Yes, this is fine. Yes, please.
Okay. Can you all hear me now?
Okay, hi everyone. So sorry. Seems that means network is a bit shaky. But yeah, thank you, Gbenga, for such an insightful session. Really, really so much to learn, and going forward, thank you for walking us through, how we could, for those who are interested, navigate the career path in nutrition policy and advocacy. Thank you for your time. Thank you for your knowledge. Thank you for sharing with us. We really value you. So, everyone, the recording to this session will be up on our page, right? And as soon as that's done, we'll obviously share on the volunteer hub. Thank you, everyone, for making out the time to attend this, session, right? You are here from the beginning to the end, 5 bozas for you. Thank you so much for making out the time. I understand. I know that we all have, busy schedules on our end. So thank you all for making out the time. Thank you so much again, Gbenga. It's really, really a pleasure to have had you on this session. You made it all worthwhile to have stayed from beginning till the end. Honestly, you made it all worthwhile. We are so super grateful. And maybe we'll have you some other time. Thank you so much. Thank you.
Yeah, thank you so much.
Yeah, thank you. So everyone, please have a very, very lovely day. Enjoy the rest of the day. Thank you. Bye from all of us at Impact Nutrition Africa Initiative. Thank you.